A lot of people actually feel that what happens in Africa stays in Africa. But with infectious disease, that's not the case. All it takes, like I said, is one person to get into an airplane and fly 12 hours away. And if you don't detect that person before he's already spread the infection, what's happening in Africa no longer stays in Africa.
On the afternoon of July 20, 2014, Patrick Sawyer, a Liberian businessman, collapsed at the Lagos airport and was rushed to a private hospital. Ebola, one of the world's most contagious diseases, had arrived in the most densely populated city in Africa.
The doctor who saw him the first night that he came in got infected and he survived. I saw him the second day and I got infected. And the nurse that I had actually sent into the room to clip his IV, who was 8 weeks pregnant at the time, expecting twins. And as soon as she tried to clip the IV, Mr. Sawyer sort of yanked off the IV from his arm. The blood just went gushing out of the vein, spilling onto his bed sheet, spilling onto the bell that usually he would press to call a nurse, and spilling onto the nurse's hand as well. She got infected. She was actually a bed away from me at the isolation ward, and she didn't make it. It was just Ebola had a field day.
The Ebola virus is a ruthlessly efficient killer. Chances of surviving the disease are 50-50, the same odds as a coin toss. In 2014, Ebola killed over 11,000 people in the West African countries of Guinea, Sierra Leone, and Liberia, the largest and deadliest outbreak in history. But in Nigeria, health officials managed to contain the outbreak to only 19 cases. The first step was to track down every person Patrick Sawyer had been in contact with.
We monitored and surveilled 892 contacts. 892.
They achieved this by repurposing a nationwide emergency operations network that had been established to fight polio several years earlier.
We are lucky. Lucky because we had people, trained people there to fix the things in 28, 48 hours. Surveillance, community engagement, participation, case management, laboratory diagnosis, all of this was done at the same time.
This massive public health effort made it possible to contain Nigeria's outbreak relatively quickly, saving thousands of lives.
WHO officially declares that Nigeria is now free of Ebola virus transmission.
Nigeria doesn't have yet the ideal health system. If we have a good coordination mechanism, if we have the political will to do, if we have all the necessary resources that are needed in place, this helps us even when the system is not fully operational.
It would take another 2 years and $4.3 billion to contain Ebola in all of West Africa, almost 3 times as much as it would have taken to build the kind of strong health systems capable of stopping the virus in the first place.
Why did the international community step in when Ebola blew out? Because there was a threat to the international community. If there's no threat to the international community will not do anything. If you know that there are countries that are struggling with basic, essential health coverage, and there's a lot that you can do, why not do it to strengthen it for them? You actually end up strengthening your own healthcare system. And so that when the time comes, you're not going to pay the price for not doing what you ought to have done when it was time.